The National Organ Donation Day is observed on August 3rd, and the purpose of this day is to spread awareness and the importance of organ donation. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospitals, the Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about organ donation in our today's episode. Joining our discussion today is Dr. Venkatraman Kola, Clinical Director of Critical Care, Yashoda Hospitals. Welcome to the program, Doctor. So, Dr. Kola, to begin with, can you explain the significance of organ donation in our country and their life-saving potential?
So, in India, we have a donation rate that's close to 0.01%. So, the number of organ donations happens close to 940 according to NATO's recent release. Whereas the potential of organ donations from the pool of this young brain dead patient is huge and humongous. So, that means 99.9% of these organs are getting wasted. Okay, those who actually land up into a brain dead or others. So in India, we have a patient pool who are suffering with either a chronic liver disease into liver failures, or a kidney failures, or a lung failures, or a heart failure. And all these patients need a immediate organ transplantation. Without this organ transplantation, probably their lifespan will be very, very limited and short. To actually change this lifespan of these patients, we need this organ to be donated. So as a country, we have a humongous, huge potential, but the organ donation at this point of time is very, very small and the tip of the whole iceberg of the possible potential organ donors which we can have.
So I'm sure organ donation can be a complex process. So could you outline the process of becoming an organ donor?
See, as a regular public, if you are aware of organ donation and organ donor, you can actually volunteer yourself at this point of time itself that I wanted to donate my organ if, God forbid, it comes to a situation where if I am brain dead and my organs need to be donated. Again, at the time of the donation, again there will be a further consent from the family members. But the first step is you can actually appeal for an organ donation by carrying a certificate of your own saying ki I am willing for my organ donation. This is the first part. Second, if we come across any patients or any individual who actually had a irreversible severe brain damage or injury, that leading to brain death. So how we actually know this patient is brain death? They should have a irreversible brain damage proven by some imaging technology like a CT scan or an MRI, and legally in the Brain Death Declaration Act, there are a set legal guidelines there which a set of doctors to follow and examine these patients after confirming that this patient had an irreversible brain injury in the CT scan or an MRI. Then in a time of 2 hours, that's called an apnea test, they declare these patients as a brain dead in a gap of 6 hours, 2 times apnea test. This is a set of protocol guidelines which are there from the Government of India and Brain Dead Declaration Act, which will allow our doctors to actually declare these patients brain dead. To simplify this, if a patient gets irreversible brain injury, most common causes are if somebody gets a road traffic accident and brain is damaged beyond repair, or somebody had a brain stroke with bleed, or some stroke where the brain has gone into a damage which cannot be repaired and it went beyond repairable state or reversible state, then we declare them as a brain dead after these 2 apnea tests with a set of guidelines. So these are the potential cases where we believe they can be a brain dead patients.
So I'm sure there's still a lot of stigma around organ donation, especially in our country, and also there are many misconceptions around this. So could you clear some and encourage people to become organ donors?
Can I donate an organ? Who can donate an organ? These are all the myths which we see. So as I told you, if a patient is having an irreversible brain damage and he's ready or he is a potential for a brain death declaration and can donate organ, there is no age bar. So many people think that elderly age group, a too old age group is a contraindication or not, that organs are not suitable for organ donation. It is not true. We have seen in our own experience, patients more than 70 years old also have donated their livers, kidneys and lungs and heart if they found to be suitable. So age is not a upper limit. In the similar way, we also believe that, or there are some myths that children's pediatric age group cannot donate organs. No, the pediatric age group organs also can be suitable for those who need in that age group, like a liver or a kidney. That is one area. Religiously, there are also some myths that religion-wise, the religion doesn't support organ donation. Most of the religions in the world now started believing and supporting the organ donation, and that myth of the religion not supporting the organ donation is no more true.
So doctor, I'm sure not many are aware about the differences between a living donor and a deceased donor. So can you explain the importance of this?
Currently, we need probably 10 to 20 times more transplant than what we are doing right now in India. And if I look at 2022 data, out of 14,000 transplants which happened in India, 90% of them are from a living donor. That is, some of the family members or relatives with a matching have donated their kidney or their liver to the loved ones for their life-saving measures. So the living donor can happen for a kidney and a liver, but we will probably need a brain-dead donor, deceased donor for a lung and heart, because living donor cannot actually donate his lung or a heart because we have only one heart to live, so we cannot donate. Even though we have two lungs, we cannot actually have any option of donating an organ or a lung. So lung and heart needs a deceased donor, whereas a living donor can happen with your kidney or a liver. So this is what it is. So living donor are 90% at this point of time, but this awareness is required that we as a family members can donate one of our kidney or liver for our lived ones, so that the living donor transplantations will also go up. And the deceased donor, the number is too low, that is less than 10% at this point of time, should be worked on so that we will increase these organs which are getting wasted, so that these more patients will get the organ donation and new life.
I'm sure all the donors create a huge positive impact, not just for the patients, but also on their families. So can you share some success stories highlighting this?
The most common organs which donations happen is related to the kidney, liver, lung and heart. See, recently we had a IT professional who has been suffering with a CKD, and he was used to come to this hospital thrice a week for his dialysis, and he was going through that all adversity of this need of the regular dialysis and the impact of this CKD disease. But once he received in the last week a renal donor from a deceased renal donor, he got transplanted, and now he has got discharged in less than 5 days of time from our hospital. So his renal recovery has been very good in this transplanted kidney, and he will probably no more require any dialysis in the future. So what we see is these are the patients who are actually struggling with their life to actually get this dialysis regularly, can get rid of this dialysis, and the life's overall general health and life will have a good shift to a healthy style in most of these cases with the kidney transplant situation. In the liver, we had an elderly gentleman who had suffered with a non-alcoholic cirrhotic liver, probably reeling from NAFLD on a diabetic induced, and was in a cirrhotic and decompensated, also having a hepatopulmonary syndrome with hypoxia. And these are the patients who actually survival is extremely low without a transplant, and they were actually regularly visiting all the hospitals to get an organ. So this patient received a liver transplant recently in our hospital a couple of months back, and he got discharged 5 days or 6 days after the transplant is over, and probably a few weeks he was needing a rehabilitation, and after that he flew back to his hometown. So there are several stories in lung transplant also. Recently we had a middle-aged lady who had a very bad ILD, was not able to breathe, was in the ICU. So the family was prepared for a lung transplant. So we have to bridge that patient on ECMO to keep her alive for 3 weeks time. And after the 3 weeks, that patient was luckily got an organ from a road traffic accident donor. And that patient got a lung transplant 2 weeks back, and now she is back home. So these are the many stories which we see day in and out. You have to actually see to believe that after the transplant, their life transformed into normalcy. So as a clinicians, we are fortunate to see this all transformation happening.
So doctor, as organ donation is still in infancy, especially in our country, so what support is available for living donors and also for families of deceased donors, especially during and after donation process?
Actually, what happens is they are psychologically very traumatized because of that sudden demise of that particular patient. And unfortunately, most of these patients comes from road traffic accident, and they are relatively young. They may be the only son, they may be the only father, they may be the only daughter, they may be the only family member who is an earning member also. And the whole family gets into a devastating with this catastrophe. And they are actually traumatized with psychologically, emotionally, everywhere. So talking to them at that point of time related to the organ donation is a very, very difficult and challenging task. So that needs a social counselor and a doctors who are empathetic about this to slowly actually prime them for this process of possibility of a organ donation potential. And as a team of doctors, team of social workers, and as a state government, we have a Jeevan Dan program. That Jeevan Dan program sends us social worker who counsel these families, take care of their emotions, spend some time, motivate them that, okay, anyway, if at this point of time the patient's survival chances are 0, but not losing the organs or wasting the organs, we can actually use these organs for somebody's future, which can translate that deceased patient into a healthy life. So that's what the one step here it happens. The second other thing is these families get recognized not by the hospitals where they donate. Also, these families also get recognized by the state government in different platforms that they have been a part of the organ donation, and their family member, one of the deceased family member, has donated organs. So this is what at this point of time from the government of Telangana and government of India the supports are.
So thank you, Dr. Kola. It was wonderful having you here on the episode today. So before we wrap this episode, is there any message that you would like to share with our viewers?
I believe we, including I, can still be alive after our death. If we donate organs, we can still be alive in somebody else. మీరు చనిపోయిన తర్వాత కూడా బ్రతకాలని అనుకుంటే, by God forbid, and if that situation comes and you are brain dead, you can still be alive in somebody else by donating your organ. So you can be alive after your death. Don't waste, save life by donating organs.
So that concludes our today's episode. Hope this episode was both informative and enlightening, and do join us for next week as well. Until then, take care and stay healthy. Thank you.